Hello everyone, myself Dr. Arpita Shrivastava, Associate Consultant Neurologist at KMC Hospital, BR Ambedkar Circle, Mangalore. So brain stroke or cerebrovascular accident is usually of two types. It could be ischemic or hemorrhagic. Ischemic or hemorrhagic, both kind of strokes can present with one-sided weakness, facial weakness, speech abnormalities, or can also present with eye signs like double vision or blurring of vision or imbalance while walking. So as we discussed the usual signs, apart from those, the unusual signs includes seizures, difficulty in swallowing, nasal drips, which sometimes people assume to be throat infection and go to an ENT consultant. But these signs should be taken as a warning signs if they are sudden in onset and patients with risk factors. Younger people, yes, less than 40 years also stroke can happen. It can also happen in childhood. It can even happen in pediatric population. And yes, it can anyways and any time happen during sleep also. 5-minute signs, we don't have a cutoff value for that because stroke presents in different presentations. Few strokes are complete on presentation itself. Whatever symptoms, whatever findings they have to present, they usually will have complete on the onset. And other few kinds of strokes, they are stroke in evolution. Initially, they will have lesser symptoms and gradually they'll keep on evolving. So first minutes, there is no proper cutoff limit for strokes. Symptoms can be complete at onset or could be evolving also. Stroke, when it is about to happen, it cannot be prevented. But as you said, transient ischemic attacks or TIA, they themselves hold the word transient. Transient, that means they'll happen and recover on itself. We also can call them mini strokes in a layman term because they are very minute clots which go and block into the circulation, cause symptoms, and then they clear off from the system and then symptoms resolve. But these transient ischemic attacks are a very big warning signs for future strokes. If a patient had a TIA in past, they need to be evaluated completely from their neurological point of view, hematological point of view, as well as neurological and cardiological point of view, and start on the treatment. And this treatment will help preventing future strokes. So as you asked, first it's fast. Nowadays we don't just call it fast, we call it B fast. B fast are the symptoms mnemonic for the stroke, where B stands for balance abnormalities, E stands for eye signs, F stands for facial deviation, A for arm weakness, S for speech abnormality, and T for time. Time here is most important. In neurology, we call time is brain. So if anyone is experiencing any abnormalities of B, E, F, A, S, they immediately need to report to a neurologist. Better to come to a tertiary center directly so that they can be evaluated, tested, and treated for stroke. Then as you asked for aspirin, aspirin depends, is the treatment only for ischemic stroke. So first and foremost, they need to report to a neurologist, get evaluated, get their scans, neuroimagings done. And if it is an ischemic stroke, then only aspirin is given or any other anticoagulation. But if it is a hemorrhagic stroke, aspirin is contraindicated.